Hi, this is Dr. Wayne Whalen, Chief Content Officer for HelpWhatHurts.com. I want to talk to you a little bit about tennis elbow. So it's a very common problem, and you don't have to play tennis to get it. The medical term for it is lateral epicondylitis, and it refers to where the tendon of the muscles of the forearm insert into the outside of the elbow. You can get a similar problem on the inside called golfer's elbow or medial epicondylitis, but that's less common. It's caused by overuse of the muscles of the forearm that move the wrists and the fingers, and you may not realize that the muscles that move the fingers are not really in the fingers, they're in the forearm. And you can test that yourself by laying your fingers on your right below your elbow and then wiggle your other fingers. What you'll feel is those muscles begin to move. So you can imagine what happens if you do this thousands and thousands of times a day on the computer or texting or whatever, or you're pounding a hammer or using a tennis racket or some other activity that includes a lot of gripping and grasping force. So over time, you can see how that tendon would become damaged. So your provider can pretty easily make this diagnosis, but the question is, what do you do about it? So many people will try anti-inflammatory medication first, which is fine, but oftentimes that doesn't work. You can try using braces that wrap around the forearm here to try and take some pressure off where the tendon inserts into the elbow. Other therapies, physical therapy type therapies, include things like ultrasound, electrical stimulation, neither of which has been shown to be particularly helpful. Low-level laser therapy may be helpful. Deep tissue massage can sometimes be helpful. Physicians will often use a cortisone injection, which makes it feel immediately better, but the problem is over time that cortisone, those steroids, tend to weaken the tendon and make you more susceptible to worse problems down the line. Some more recent treatment options include what's called extracorporeal shockwave therapy, where they blast sound waves at the tendon to try to stimulate a healing process, or what's called PRP, or platelet-rich plasma, say that 3 times fast, which also helps to stimulate your body's healing capacities. So if your elbow pain doesn't get better quickly, you may want to see your provider. And if you want to explore those other options that I just mentioned, check us out here at HelpWhatHurts.com. We have a lot of information on them. And as always, this is Dr. Wayne Whalen. Thanks for listening.